In the communities that are most impacted by health inequity, generally there's really inspiring entrepreneurs and NGOs that exist there, but the way the current system is, they often don't get to participate in the solutions. And so what our goal of our fund is to first address social determinants of health solutions and support those evidence-based approaches, but also go into those local communities and help source and broaden the pool of actors that actually get to participate in trying to drive towards a solution.
Smart from the Start is a family support and community engagement initiative that has as our mission to promote the healthy development of young children and families living in underserved communities. The Social Impact Fund has provided myself and organizations like mine with the unique opportunity to leverage a substantial level of funding to really breathe life into a number of the initiatives and programs and services that we haven't been able to provide our families. It is an opportunity to innovate.
Fathers Uplift is the country's first outpatient mental health and substance abuse treatment facility for fathers and their families. I think businesses like myself are creating new approaches to addressing some of the world's largest issues. And some of these approaches have not been seen before. I would say that's why the fund is so important. They don't necessarily focus on what's been done and what's normal. They focus on investing in new strategies and new ways of tackling some of the world's largest problems.
Currently and historically, most of the resources applied to addressing homelessness is in the emergency shelter system. And Home Start was created to provide services on the front end of the shelter system and on the back end of the shelter system. We have solutions that are solving the problems. Being in a financial position where you can respond to and scale up those solutions is difficult.
About Fresh is a Boston-based organization that builds programs that integrate healthy food into community healthcare. There's a lot of really promising social entrepreneurs that have fantastic ideas with the potential to transform communities for the better in a variety of different ways. If there were more programs like the AHA Social Impact Fund, I think we'd see more promising startups not only just come to life, but also go to scale. I think you'd see more rapid innovation.
It is probably the most difficult part of my job to raise funds to keep the programming going.
The Social Impact Fund was different from our experience with other funding partners. One, because it was fast and efficient, and I think because it was extremely rigorous and thoughtful.
As a, grassroots, community-based organization that's run by, quite frankly, women of color, it's been very difficult for us to engage larger funding resources.
They don't just give you a check and say, hey, go. They give you funds, but also an opportunity to really grow as an organization, as a leader, as well as to think strategically about your business and your concept of serving the individuals that you're working with.
The American Heart Association gave us an opportunity to say, hey, this is who we are, this is who we serve, this is what we do, and this is what we really would like to do more of or do better. And they said, well, here you go. We're going to work with you, not only to implement this, but to measure it and to continue to build support around it. If you want to make a real change and have a real lasting impact, this Social Impact Fund is where the rubber hits the road. This is not just about giving, it's about changing their way of life. It's about changing the trajectory of folks' lives.